Okay, so I'm going to teach you guys a subcutaneous stitch. So normally you're going to want to use a absorbable stitch for this because it's going to be buried. I'm using a Prolene stitch, something that's not absorbable, just for contrast on the simulator. So first start off with a deep to superficial bite, and you're just going to tie a knot here just to anchor your tail in the deep tissue. So you can tie that. Again, monofilament 6 times. I'm going to pretend that this is like some monocryl. I'm going to do 4. And then you can cut your tail short for your buried knot. Just kind of a word of wisdom. Some providers will tell you that you should do, some surgeons will tell you should do a deep to superficial and then a superficial to deep and then tie a knot. But I found that is dependent on who you're learning from. So after you've anchored your suture, kind of pull it to the side. Then you're going to want to do a deep, to superficial bite. And you're going to want to try to come out right at the apex of your incision, at the dermal epidermal junction, or right at the skin edge. So we're going to just kind of come out right there, right at the edge. This is one of the stitches that you're going to use a lot on your general surgery rotation to close incisions. So after you've come up through the dermal junction there, you're going to start again as close to the apex as you can and just take a bite just in the subcutaneous or staying in the dermal epidermal junction kind of space here. And start traveling down your incision. So once you start traveling down your incision here, you're going to want to make sure that you're taking your bites directly across to a little bit back towards your starting point, so that when you pull your needle through, these lines that are formed subcutaneously end up parallel under the skin edge. So if you can see right there, that one's looking pretty parallel there. When you start and you're close to the apex, you're going to want to start with rather small bites, and then you can progressively get a little bit more aggressive, taking some bigger bites here. So take some bigger bites so this video doesn't end up being super long. Trying to stay right close to the skin edge. And as you're going, you can kind of pull your tension through, close your wound down. I've heard some residents say they like to do maybe 3 to 4 bites, depending on what kind of tissue they're suturing, and then pull it through to save them a little bit of time. But if you want to pull through on every stitch, that's completely okay. The one thing I'll tell you about pulling through on every stitch is that you're going to lose a little bit of your tension as you're loading your needles and taking your next bite. So that's another thing that's kind of in favor of doing it every couple bites. So big things with your subcutaneous stitches that you're going to want to kind of avoid. So on that one, you can see I traveled a little bit too far down the incision there, and now I don't have a parallel line there, but I'm going to leave that in as an example of what not to do. I'll give you another example of what not to do. One thing that you're going to want to be very careful of doing is making sure that you don't buttonhole. So what a buttonhole looks like is right here, when you're inverting the skin edge, your needle comes through the skin like that, enters back in, and then what this will look like once you pull it through is, rather than being completely buried, you end up with a buttonhole. So if you see right there, there's a little bit of suture that's exposed to the outside world. So that's going to be a no-no, and people are going to be really angry. So if you buttonhole, you're going to want to take it out. You're going to want to back up. Try to avoid doing it in the first place. Some people are going to just take over for you if you buttonhole, or they're going to cut it out. But you can try to get your needle to go back through sometimes. Other times you're just going to have to cut your whole stitch out and restart. But be very cautious when you're taking your bites that you're not buttonholing in the first place, and you're going to save time. So to kind of finish this video, just going to show you how to finish off your subcutaneous stitch here. So what you're going to want to do is you're going to want to leave a loop after you've kind of started to get close to your apex. So I could do a couple more bites here, but in interest of keeping this video reasonable, we'll stop here. And what you're going to want to do, form a triangle with two of your fingers, grab your suture, pull it through, and you're just pulling through a loop. You're not pulling through the needle. And again, you're going to do that again, and you're just kind of shimmying your suture down and forming these triangles. You're going to do that 3 times, 4 times for some attendings, and then pull your needle all the way through the loop. You can reload, and then in order to bury your knot, what you're going to do is go deep to superficial inside your incision, and then come out somewhere that's not in your incision, pull through. That'll pull your knot down, and then you can cut with the skin edge here. So in normal human tissue, this will be a little bit more approximated, but you get the idea that all your stitches are going to be buried beneath the surface.